Do you have an individual and family plan health insurance policy, and are you soon to transition into Medicare, and you could use some help with that transition to a new policy? Hi, I'm Tommy at MedicalInsuranceToday.com. So we do a lot of individual and family plans and Medicare here at Medical Insurance Today. We do work in both those markets. Individual and family plan policies have gotten historically crazy expensive. Going into 2026, the rates are just out of control. And I get a lot of questions about people as to what will happen when I go into Medicare. So I want to touch on that a little bit and give you some details as to what's available and what will happen as you make that transition. So number one is Medicare is a far superior product to any insurance that you've ever had. Medicare is awesome. I love working with Medicare clients because generally they're near retirement, they're relaxed about their insurance, and they are going to be spending significantly less and have lower copays and just have overall better coverage when they go into Medicare. So they're generally really, really happy. Folks in the individual and family plan market are still dealing with copays and deductibles, high deductibles and high copays and high premiums. And you're just going to save a bundle of money when you go into Medicare. So it's a really, really good thing. And many folks are not aware of how good Medicare is and are a little bit reticent of the move. Not just because they're turning 65, that's a big part of it, but it's also the unknown of what's coming. And I'm here to shed some light on the fact that Medicare is just a phenomenal product for folks. Not that individual market plans are bad; they just cost more, and they're a little bit more involved with individual market policies. So to touch on that, what most people I find the complexity and confusion comes in is when you have a family. So let's say that you got a husband and wife and they got, late teenage, early 20-year-old kids. So mom's 60, dad's 64, and they got a couple kids on the policy. Dad's going into Medicare, and everyone says, well, what's going to happen? I have no idea how this works and what's going to occur. So there's a little chain of events. 6 months before you turn 65, you want to start engaging what's available and start looking at Medicare plans. And I would love to help you, or make sure you're talking to your agent about what's available out there, because it'll prepare you for what needs to happen, because there's a distinct timeline that you need to follow also going into Medicare. So 6 months before is our recommendation, and then you're really going to get to work about 3 months before you go in, before your 65th birthday, to start enrolling and start the process of engaging into those plans with Medicare. The confusion comes in, say, well, what's going to happen to my family? The spouse and the two kids are going to remain on that individual and family plan for the time being. So kids can stay on the plan until they're 26, and the missus or the spouse is going to remain on that individual family plan until they turn 65 and they move into Medicare, which we do a lot of this, we call it a split, where one's going into Medicare and the family's staying on the individual and family plan. So we're very adept at this. It's something we specialize in, and we're very knowledgeable and very good at it. To talk about Medicare and what comes with it. In California, you have distinctly two types of plans, and nationwide there's a lot of available market types plans depending on where you live. But in California, you've got Medicare Advantage and you've got Medigap. So they're kind of like two sides of a coin, I like to say. So Medicare Advantage historically is HMO, but there are also PPOs available. In California, most Advantage plans, not all, but most will have a 0 monthly premium, so there's nothing really to pay. And again, with Medicare, when you go into Medicare, you have next to nothing out of pocket when you go. On Advantage plans, it's 0 copay on the doctor and hospital and surgeries and testing and your physical, and very low copays throughout any usage of your coverage. Advantage plans also come with dental and vision and hearing and a gym membership, and most, especially the HMO plans, will come with a string of additional benefits: chiropractic and acupuncture, and a Fitbit, and a personal emergency response system, and over-the-counter benefits. There's a string of benefits that are offered with Medicare Advantage. There are also PPO Advantage plans out there, which most people are not aware of, and these are a distinct option away from Medigap, where you can keep a PPO insurance. What that PPO Advantage does is just raises your copay a little bit. So you're going to spend a little bit more at the doctor and at the point of service, not much, but a little bit more, and compared to a Medigap policy, but it gives you PPO access to choose your doctors and choose your specialists without a referral. Medigap historically is going to cost you at 65 about a little under $200 to a little over $300 a month, depending upon the plans that you choose. Medigap is the traditional supplemental and allows you to go to any doctor that takes Medicare nationwide. And what you're paying for in that roughly $200 to $300 premium at age 65 is access to go wherever you want and to pick and choose where you go for care. That's the primary benefit. But overall, in contrast from an individual and family plan market to Medicare, Medicare is superior by far. There's no question about it. Medicare is awesome in terms of what it offers. And, not that, again, individual and family plans are bad. You got to have insurance, but they're just, you got higher copays and higher deductibles to deal with. And most folks that when they're on an individual and family plan, it's, you don't get benefits through a job, or you, are at a job that doesn't offer the benefits, or a lot of self-employed people, a lot of self-employed folks we help. So, you have to buy it on your own. And that offers a layer of complexity and expense that comes along with it. But it's an area of expertise that we excel at here at Medical Insurance Today. So in either case, if you have an individual and family plan market, we'd love to help you. If you are in an individual and family plan market going into Medicare, we would love to help you. And even if you're about to retire from your job, we can help you into the Medicare market as well, and potentially find a plan for your spouse if you're married in the individual and family plan market. If they're not yet eligible for Medicare, we can help them into an individual policy and you into Medicare. That's what we call the Medicare split, so to speak. So it is a lot easier than most people feel and most people think. There's a lot of information out there. It comes in the way that it's marketed and packaged to consumers, very confusing, but it's really a lot more simple than people think. And that's what we do here, is to help simplify the process, manage the process for you, and we do that all free of charge to you, the consumer. So reach out to us. If we can guide you and help you, we would love to do so. MedicalInsuranceToday.com, and we look forward to serving you.